Welcome to MedCognito Nclex. We are live, and today is all about hypothyroidism. So tell a friend that we are here to dive deep into hypothyroidism for Nclex. So let's get everybody to join in. Let's forward the link to our friends so they would all join in and we can dive into hypothyroidism. So I'm giving you 1 minute. Just click on the link as I'm also doing and share. Share with your friends. Let them join right in. Let them join right in. I'm sharing into the Nclex group. Yes. We are live. So kindly join in. Invite all your friends to join in right now. And let's start. I'm dropping it into our group. So share the link. Tell a friend that after today, they will be able to answer every question on hypothyroidism. So come right in, and let's start. And feel free to let us know where you are joining us from. I am Dr. Julia. I'm reaching out to you from Ontario, Canada. It's always a joy to join you on Tuesdays for our Nclex reviews. So join in from everywhere. If you're on YouTube, say hello. If you're on Facebook, if you are in our group, say hello, and let us know where you are joining in from. We're starting right away. We want to make good use of our time. So let's start right away. Hypothyroidism. So as we do every time, we always have great news for you. And the great news is that you have been given this beautiful opportunity to ace your Nclex exam. And that is, we have some well-prepared mock exam for you so that right in the comfort of your home. Thank you, Isaac. Good to have you join us. Welcome to our free Nclex review. And I have this great news for you. You have the chance to have a feel of how the exam will be like. You can dive into any of our high yield mocks. We have high yield mocks too, and we have pharmacology mock as well. And feel free to email us at medcognitoclass@gmail.com, and we will send you links as to how you can participate in this mock. It's only for 29.99 CAD, and with this, you can purchase any of the mocks. You get the link for the mock, and right in the comfort of your home, get seated and dive into it. And it helps you to have a feel of the exam. And after the mock exam, you will get your results. You will get to know the answers to the questions that showed up in the mock. And you send an email request for a performance report, and you're going to get a report as to your weak areas and your strength areas. And this helps you in your studies. It helps you to know where you should focus on as you study and prepare for the Nclex exam. We want to be a part of your success story, and we want you to ace this Nclex exam one time. So yes, I'll be dropping the link. You can even register now if you've settled on it. Register for our mock exam, which goes for 29.99 CAD. Dive right into the mock and have a feel of how sitting for the exam will be like. So I've dropped the link. And in case you are not in our free group yet, let me drop the link as well. We have a free WhatsApp group, we have a free Facebook group. You can join all of that so that you are not going to miss any updates. or our Nclex reviews and any resources that we would have to guide you in preparing for your Nclex exam. So you can join the free WhatsApp group. We'll be putting in updates in that group and you get quick updates and you're able to join us and you do not miss any session. So tap on the link and join and you can share with friends and colleagues who want to take Nclex and they need support. So copy the link and share with all your friends who would want to write the NCLEX exam. And I've dropped the link for the mock exam. If you want to take our mocks, tap the link, register, send an email to MedCognito class. MED is here, MedCognito class at gmail.com. And right there, you're going to receive the link to start the mock in the comfort of your home. Put yourself under exam conditions and dive right into the mock exam. And right after the exam, you get your answers to the questions with a rationale. And we would also send you a performance report that helps you to know your weak areas and areas that you should work on so that you will be well prepared to ace this NCLEX exam one time. That is good news, right? Give me a yes, yes in the comment box if it's good news for you. Great. So we wouldn't waste much time. Let's dive right into hypothyroidism. So what is hypothyroidism? Hypo. So as the name implies, hypo. So low low thyroid hormones. So hypothyroidism is a condition where the thyroid gland does not produce enough thyroid hormones. So we have low T3 and then low T4. So I hope you got it. You have a condition where thyroid gland does not produce enough thyroid hormones. So low T3 and low T4, which are the thyroid hormones. So let's now look at the key thyroid hormones. So we have what we call the T4, that is thyroxine. So that is the primary hormone that the thyroid gland produces. And we have TSH, that is thyroid stimulating hormone. And remember that thyroid stimulating hormone is increased in hypothyroidism as the body tries to stimulate the thyroid. So if you have low thyroid hormones, the brain senses it that wow, you need more thyroid hormone. So it will produce the thyroid stimulating hormone. So go stimulate the thyroid to produce more thyroid hormones. So do not get confused with these terms when you see them. Primary hypothyroidism, secondary hypothyroidism. So primary means that the primary gland producing thyroid hormone is what? The thyroid gland. So if you see primary hypothyroidism, it means that the problem is from the thyroid. So I hope you got it. But when you see secondary, it means it's from somewhere else. So the problem is from up the absent is from the brain. So it's from the pituitary or the hypothalamus. So always remember the terms primary hypothyroidism means that the issue is from the gland itself, and then secondary means it's from a higher center that is the brain. So from the pituitary or the hypothalamus. Great. So I hope you are with me. So there are several causes of hypothyroidism. So number one, we have what we call Hashimoto's thyroiditis. So that is autoimmune destruction of the thyroid. Number two, we have iodine deficiency, which is common in developing countries. So that is a cause of hypothyroidism. And then remember, from pharmacology, some medications can result in hypothyroidism. So a client on lithium, a client on amiodarone can have hypothyroidism. Number four, thyroid surgery. So if you have the thyroid gland being removed or it's been exposed to radiation, then the client can have hypothyroidism. And that is especially in clients who had hyperthyroidism or cancers and they were treated. And number five, we have what we call congenital hypothyroidism, and that presents at birth. Are you with me? Did you get the causes? Did you get the primary hypothyroidism and secondary? I hope you understood it. So give me a yes, yes in the chat box if you got it, and we will move on. Great, let's advance. So, if a client has hypothyroidism, how is this client going to present? So, let's look at some of the symptoms. We have grouped them. We have metabolic symptoms. So, this client is tired, so fatigue, weight gain, cold intolerance. So, let me give you this tip for symptoms for hypothyroidism. Everything is low, everything is slow. Everything is low, so hypo is low. So everything is slow, slow. So you are tired, there's reduced metabolism, so there's weight gain. Client is not producing heat, low heat, so there is cold. Then in the cardiovascular system, so everything is slowed down, so the heart rate is reduced. The blood pressure is reduced, so that is hypotension. Then in the gastrointestinal tract, so the movement of the bowel too is reduced, is slow, so there is constipation. I hope you got that. And let's look at neurological system. Client is depressed, low mood, memory loss, slow thinking. So the skin and the hair, client will come with dry skin, brittle hair, and hair loss. In the reproductive system, there is irregular or heavy periods. So I hope you got these symptoms. Always remember slow, low, that is low thyroid hormone, hypothyroidism. Everything is slowed down. So that should guide you in the presentation. So a quick recap on what hypothyroidism is. It is caused by underactive thyroid gland. Thyroid gland doesn't produce enough hormones and it leads to sluggish metabolism. So everything is slowed down. So there's decreased thyroid hormone that is T4, and therefore the thyroid stimulating hormone will increase. So I hope you got that from the beginning. And as I said, for the symptoms, everything is slowed down. So let's use this mnemonic as we do it here to help you remember. Slower heart rate and GI motility. L. Hair thinning or hair loss. O. Client is feeling overly cold. W. Weight gain despite a decreased appetite. So everything is reduced. Appetite is reduced, but client is gaining weight. E. Eyelids, so puffy eyelids. R. Delayed reflexes. So anytime you want to remember, use slower, the slower mnemonic. And this you should not forget. The complication of hypothyroidism. We'll dive deep into it, but remember, mesoderma coma is a complication of hypothyroidism. It is a severe form of hypothyroidism and is an emergency and requires emergency treatment. So always remember, thyroid gland produces So yes, hypothyroidism occurs when the thyroid gland produces insufficient amounts of thyroid hormones, T3 and T4, and that leads to a slowed metabolism. And one of the causes, remember, autoimmune. So Hashimoto's thyroiditis and iodine deficiency is a cause, and then thyroidectomy is a cause. So do not forget this. So let's use this image as well to remember the symptoms of hypothyroidism. I don't want you to forget. So you can see this let's say a woman here feeling so cold. So how she is dressed up shows that she is cold. So client has cold intolerance, client is tired, client has gained weight, there's low heart rate, bradycardia, there's constipation, dry skin, and hair loss. And remember the complication, mesoderma coma. That is severe hypothyroidism that leads to coma. So there's hypothermia, low temperature, hypotension, low blood pressure, and hypoventilation. So do not forget these symptoms because I'm stressing on them over and over again. So how then will we treat hypothyroidism? So by giving levothyroxine. So give them levothyroxine. Remember levothyroxine. And when we give it, we monitor the TSH level. And some clients will mostly be on lifelong hormone replacement therapy because they do not have the thyroid hormones, so they have to be given it externally. So they will be on lifelong hormone replacement therapy. So we're going to dive into some high yield points for Nclex that you must never forget. So let's dive deep into the hormone replacement therapy for hypothyroidism. And you remember I said we give levothyroxine, and that is the most common treatment for hypothyroidism. It is a synthetic thyroid hormone replacement. So what should you know for Nclex? Administer levothyroxine in the morning on an empty stomach. So this will be relevant in your client's teaching. Administer levothyroxine in the morning on an empty stomach. And why should you do this? This helps to enhance absorption. I hope you got it. Levothyroxine for hormone replacement therapy and administer it in the morning on an empty stomach. Why should you do that? To enhance absorption. Number two, monitor for mesoderma coma. As I told you earlier on, mesoderma coma is a life-threatening complication of severe hypothyroidism, and it is an emergency. So you have to know the symptoms so you can pick it up and save the client. How will this client present? Everything is extremely low, low temperature, low blood pressure, low heart rate, respiration is depressed. So the Nclex tip here is that how are you going to save this client with mesoderma coma? We're going to give IV levothyroxine. IV levothyroxine. Client is cold, so warming blanket, and then supportive care in the ICU. So do not forget this. It is life-saving. IV levothyroxine, warming blanket, and supportive care in the ICU. So have we gotten it so far? Hormone replacement therapy and then monitoring for mesoderma coma. Let me have some yes in the chat box so that I am sure that you are with me. Yes, so for Hashimoto's, so yes, the TSH is increased. Yes, that is good. TSH is increased because it causes hypothyroidism. So the thyroid stimulating hormone will increase so as to produce more thyroid hormone. So give me some yes, yes, yes in the chat box if you are fine, so we can move on. I want to be sure that you are with me so we can dive right into yes, yes, yes. Let me know that you are here with me. Can I get some yes, yes, yes in the chat box? Let me get your yes and then we continue. I want to be sure that you are here with us. Yes, okay. Thank you so much. Thank you. Thank you so much. I really appreciate the feedback. All right. So let's dive right into the cardiovascular risk. So this is a key Nclex focus point. Hypothyroidism will cause bradycardia, elevated cholesterol levels, and then an increased risk of atherosclerosis. So the Nclex tip here is that for a client with hypothyroidism, monitor heart rate and cholesterol levels, especially in older adults. So this is a life-saving point. And remember, a client with hypothyroidism will come with constipation. So hypothyroidism slows down the gastrointestinal motility, leading to constipation. So the Nclex tip here is encourage high fiber foods, adequate hydration, and regular physical activity. What about cold intolerance? Patients who are usually cold intolerant, and it is as a result of the slowed metabolism. So we're going to provide blankets and educate the client to dress warmly and avoid cold environment. Weight gain. So there's unexplained weight gain in hypothyroidism due to decreased metabolic rate. So the Nclex tip here is encourage healthy eating and regular exercise, and that helps to manage the weight. And this you must not forget. A client on levothyroxine therapy teach patients to take their medication in the morning on an empty stomach about 30 minutes before eating. So I hope you got it. About 30 minutes before eating. And then they should discontinuation, avoid discontinuation of levothyroxine. Lifelong therapy is typically needed. And if a client is on treatment, we have to monitor for signs of hyperthyroidism. So overdose. So monitor for signs of hyperthyroidism in case the client has an overdose of the medication being given. And how will this client present? This client will come with palpitations, heat intolerance, and then weight loss. So always have this at the back of your mind. This client had hypothyroidism and is being given thyroid hormone. So the client can rather tip to the other extreme and would manifest symptoms of hyperthyroidism. So please, please, please always remember this. Always remember this. Do not forget. And you have to also assess for signs of mesoderma coma. Remember, I told you that that is a serious complication of hypothyroidism. So this client has severe hypothyroidism and it requires immediate medical care. So always have this at the back of your mind and look out for mesoderma coma in scenarios on hypothyroidism. And we have to educate patients on the importance of regular follow up blood tests to monitor the TSH levels. So yes, I promise that we're going to look at mesodermal coma into detail because you should not miss it. So, as we said earlier, it is severe, life-threatening hypothyroidism. So this client will come with a puffy face. So everything is extreme. Puffy face, orbital edema, non-pitting edema in the hands and the feet. They would have hypothermia, so low temperature, low heart rate, low blood pressure, and respiration is decreased. So, how are you going to manage this client? Because it is an emergency. IV level thyroxine. Do not forget it. IV level thyroxine, and then corticosteroids, and then supportive care in the ICU if needed. So I hope you got it. Let me get some feedback in the chat box so that I am sure that you are good. Let me get the feedback so I'm sure that you are good. All right, great. Thanks so much for the feedback. Yes, and Nadia with Hashimoto's thyroiditis. Yes, I said that the TSH will be increased and then there will be low thyroid hormones. So the thyroid hormone will be low. So let's now summarize what we just studied. Symptoms for mesodermal coma: fatigue, weight gain, cold intolerance, constipation, and bradycardia. And remember, treatment is levothyroxine. And remember to teach the patients to take medication in the morning on an empty stomach, and that enhances absorption. And since mesodermal coma is life-threatening, we have to always monitor for it because it can lead to hypothermia, hypotension, and hypoventilation. So this slide is very important because you may meet questions and you will be asked to determine whether TSH will be normal, TSH will be high, or whether T4, the thyroid hormone, will be high or low. So let's take a look at it. T4 is the main hormone produced by the thyroid. And then TSH will stimulate the thyroid to do its work. So if a client has hypothyroidism, it means that the client has low thyroid hormones. So T4 will be low on the labs. And then since T4 is low, it will tell the brain, we are low on thyroid hormone, we need more thyroid hormone. So thyroid stimulating hormone will therefore increase because it has to stimulate, I have to do my work. I have to stimulate the thyroid gland to produce more because there is low thyroid hormone. I hope you got it. And then when we have hyperthyroidism, that is opposite of hypothyroidism, there is so much thyroid hormone. So if we do the labs, the T4 thyroid hormone will be high. So if you have high thyroid hormone, it will be telling the brain, the higher centers, that we have enough. We do not need any thyroid hormone. So therefore, the thyroid stimulating hormone will decrease. So do not let this confuse you. In case you got it, give me a yes, whether you're on Facebook, let me see that you have some comments, whether in Facebook or on YouTube, you can drop in the chat box if you are okay. Are you all right? Yes, yes, yes. Okay, so you got it. Great. Thanks so much. I really appreciate the feedback. So let's dive into a question that will guide us. Let's look at this question. And I also have great news for you. As we do it here, we always have a free mock exam that has a lot of questions that right after the session, you dive into it answer it. And after you're done with the mock, you get the answers and the rationales, and it will help you really understand hypothyroidism so that from today you will never miss any question on hypothyroidism in your Nclex exam. So let's take a look at this case study. Emily, a 45-year-old female, visits the clinic complaining of unexplained weight gain, fatigue, and feeling unusually cold. She also mentions experiencing constipation and has noticed her heart rate has slowed down over the past few months. Emily has a history of hypothyroidism and is currently on levothyroxine, but she admits she sometimes forgets to take her medication. So, based on the history and Emily's symptoms, which thyroid hormone level is most likely to be elevated? So remember, she has all these symptoms: weight gain, fatigue. So what does Emily have? You have to understand that as well, and that will help you to know which of these hormones will be high. So is it free T4, total T3, TSH, or reverse T3? So let's do the work. What do you think? So Emily has hypothyroidism. Yes, yes, yes. You have to get that first. And then know that yes, TSH will surely be high. TSH will surely be high. In hypothyroidism, especially when undertreated, and the client forgets to take the levothyroxine. So TSH will rise as the pituitary is attempting to stimulate the thyroid gland to produce more thyroid hormones. So remember, TSH will be elevated and free T4 would likely be decreased, not elevated, because there is low thyroid hormone, that is hypothyroidism. So I hope you got this question. No worries, I'll be sharing the link for the free mock exam very soon. You have a lot of questions to test yourself on hypothyroidism so that from today you will never miss any question on that. So let's revise what we studied earlier. TSH and T4 levels move in opposite directions. So T4 is the main hormone produced by the thyroid gland. So and TSH stimulates the thyroid to work. So if there is hypothyroidism, it means that there is low hormone. So T4 will be low, TSH will increase. If you have hyperthyroidism, high thyroid hormones, T4 will increase and TSH will decrease. So it's very important that we are able to know the difference between hypothyroidism and hyperthyroidism. So that is why we have this slide here. You should always remember this slide so you do not get confused. If we have hypothyroid patient, TSH levels will be high because they want to stimulate the thyroid gland to produce more. What about hyperthyroidism? It will be low. What about T4 levels? So there is hypothyroidism, so low hormone, so T4 will be low. There is hyperthyroidism, so T4 will be high in hyperthyroidism. And what are the symptoms? Hypothyroidism will come with fatigue, weight gain, but for hyperthyroidism, there is weight loss and then tremors. What about heart rate? For hypothyroidism, everything is slowed down. So bradycardia. And hyperthyroidism will be the opposite, tachycardia, increased heart rate. I hope you got it. So yes, 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 we got to the end of our class today, and I hope you had a good time. I hope now hypothyroidism has become clearer to you, and I'll be putting in the link for the free mock. Dive into it right now and test yourself, okay? So you do not forget all the concepts that I've shared and all the high yield and the tested areas for hypothyroidism. And yes, in case you were not here from the beginning, we have we give you the free mock, but in case you want to have that feel of the exam, we have some mocks for you. We have high yield mocks and then pharmacology mock. So you can choose whichever you want. And then the good part is that it goes for only 29.99 Canadian dollars. So just for 29.99 Canadian dollars, you have the opportunity to have a feel of how the exam will be. So that right in the comfort of your home, on purchasing this mock, you have the link, you sit behind your computer, and then dive into the questions. And right after the exam, you have the answers and the rationales to the mock exam. And we will also send you a performance report, which helps you to understand your weak areas and then your strengths. And that guides you to prepare very well for this exam so that you can ace this NCLEX exam one time. So if you have any questions on the mock, feel free to put into the chat and I will respond to you. And if you are interested, you can also type interested. I'm dropping the link right now, and you can purchase it. Whether you want to do pharmacology, whether you want to do high yield mocks, or if you want to do all of them, all the mocks in our online shop, that will be great. So I put into the chat box the link. You can tap on it and then purchase the mock exam right away. Yes, 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 yes. And yes, this is a beautiful opportunity to join us in class. Join the MedCognito Nclex champions. Hooray! Here we are committed to helping you so that you can ace this NCLEX exam on your first attempt so you do not waste time. Come join the MedCognito NCLEX champions. On joining our program, you have your own study portal and right in the comfort of your home, you have access to all the high yield content for NCLEX, over 500 short videos in your portal. You have access to a study planner that guides you. It serves as your map so that every day you know what you are doing and you do not waste time. We have workbooks that helps you to understand all that you are studying from the portal. And you come to class twice in a week. We have amazing tutors who are committed to guiding you, diving deep into the endless content so that you become so confident and ready to face the exam. Right before class, we have what we call the MedCognito Endless snapshots that you get the chance to quickly review whatever you're supposed to study in class. There are summaries that are sent to you prior to classes, and it helps you to enter class having an idea of what you will be studying, and it helps you to really understand whatever you will learn in class that day. And yes, give you mock exam that really preps you and prepare you for the exam. This is beautiful, a beautiful opportunity to ace your English exam on your first attempt so you do not waste time. Time is precious. And our bonus is the mindset coaching, which I always love to talk about because your thinking is everything. If you have all the content and you feel defeated, you approach the exam with defeat, and surely the result becomes defeat. So we concentrate on speaking to you and guiding you in your thinking so that you feel confident, you feel so bold and courageous to face the exam and be able to ace it one time with no sweat. So this is how the portal looks like. You have everything you need to prepare for the exam. We do our live classes, we focus on high yield concepts so you do not waste time. And we cover everything that you need to cover for NCLEX. This sounds too good to be true, and our students are always excited. Look at this review that class has been good so far. I'm gathering the courage and the knowledge to write the NCLEX. Topics treated are all in order and have gained much understanding. And I am hopeful that I will be able to pass the Nclex on my first attempt if I continue with the lectures. Wow, this is great. This is great. We want you to be a part of the winning team. So come join us. We have a lot of reviews showing that we've given a lot of value during our classes to help you ace the Nclex on your first attempt. So you may be wondering, what's the investment involved? And I'll say that the investment will be worth it. You are worth every investment. You are worth not wasting time. So you are worth investing in the best resource that will help you ace your Nclex on your first attempt. So if you want to join us for 1 month, a cool deal of 199 Canadian dollars. I'll be dropping the links very soon. If you are interested, just type a yes, yes, yes in the chat. As I put in the link, you want to go on the journey with us for 1 month and can keep renewing every month. It goes for 199 Canadian dollars. And if you want to go with us for 6 months to be able to get everything about your Nclex and be able to approach your exam with a lot of courage and confidence, go for the 6 month plan because it goes for 999 Canadian dollars. You have a flexible payment plan. You can pay every month, twice monthly, every 3 months. So do well to take what will work excellently for you. So 6 month plan, 997 Canadian dollars with a flexible payment plan. You can pay one time, 2 times, 3 times, 4 times, 5, 6 times. You can pay every month. So this is a great opportunity and we're reaching out to you to dive right into it and join us in class. So I'm dropping the link for the 6 month package and the 1 month package. We want to journey with you. We want to be a part of your success. We want to break the Nclex concepts to you in a simple form, just like we did today for hypothyroidism. And this sets you up for success. So I'll put into the chat box the 6 month package, the 1 month package. So 1 month for 199 Canadian dollars, and then 6 months 997. But you have a flexible payment plan. So drop in the chat box if you're interested, and I will give you the link again. I've dropped the link, so check the link. We can't wait to have you join us in class. And how was class today? Drop into the chat box. I hope you enjoyed class. I hope hypothyroidism has become so clearer to you and you are not going to miss any question on hypothyroidism. Great. Thanks so much. I really appreciate all the feedback. Thanks so much. I'm glad that class has been helpful for you today. I'm glad that you remember that for hypothyroidism, everything is slow. So hypothyroidism, hypothermia, hypoventilation, heart rate is reduced, the hair is thinning. So always remember, everything is slow. The gut is slowed down, so there is constipation, the metabolism is slowed down, there is weight gain. So do not forget. And because the thyroid gland is not producing enough hormone, thyroid hormone will be low for the labs, and then TSH, that is thyroid stimulating hormone, will increase because it is telling the brain that the body has low thyroid to produce more, produce more. So TSH will be high and thyroid hormone will be low. Never forget this, and this will help you to be able to ace all the questions that you will see on hypothyroidism. And remember, we give the hormone replacement level thyroidism. And for your client teaching, give it first thing in the morning on an empty stomach. Great. I'm so excited that you have all the tips that will help you ace any question on hypothyroidism for your Nclex. I was glad having you all join us today. Go continue to study Tap on the links, join us in class, join us in the free Facebook group as well, and then our free WhatsApp group for more updates. So let me drop the links again so you can join our free groups for more updates. So catch you again next week and keep studying a day at a time. Do not get discouraged. Success will surely be yours. And I promise to share the free mock, so wait for it right now. Let me share the free mock with you. You can also share with your friends to also try their hands on it. Try it right now, because when you say that you're going to do it later, you may end up not doing it. So I'm dropping the link for the mock. Attempt it right away. So mock on hypothyroidism. Okay, here you go. That is the link. Great, great. That's the link for the mock, free mock exam for hypothyroidism. So see you next week, and I wish you all the best.